Welcome to the Thinking Practitioner podcast,
a podcast where we dig into the fascinating issues, conditions, and quandaries in the massage and manual therapy world today.
I'm Whitney Lowe.
And I'm Til Luchau.
Welcome to the Thinking Practitioner. And welcome to the Thinking Practitioner podcast, where Books of Discovery has been a part of the massage therapy and bodywork world for over 25 years. And nearly 3,000 schools around the globe teach with their textbooks, e-textbooks, and digital resources. Books of Discovery likes to say that learning adventures start here, and they find that same spirit here on the Thinking Practitioner podcast and are proud to support our work, knowing that we share the mission to bring the massage and bodywork community thought-provoking and enlivening content that advances our profession.
Instructors in manual therapy education programs can request complimentary copies of Books of Discovery's textbooks for review in your programs. Please reach out at booksofdiscovery.com. And listeners can explore their collection of learning resources for anatomy, pathology, kinesiology, physiology, ethics, and business mastery at the same place, booksofdiscovery.com, where Thinking Practitioner listeners like you can save 15% by entering Thinking at checkout. Hey, Whitney, how you doing?
I'm doing well today, sir. How are you doing? This is holiday season, so did you have a good holiday there?
It has been a good holiday. Yeah, it has been a good holiday. I think we're going to air this in a few weeks, so, it's going to be later July maybe if you're listening to this live. But yeah, at this point in my holidays, it's
Later
pretty
July.
great. Yeah, July. Later January.
I don't think it'll be quite that late.
We don't have quite that big a delay, but yeah, there's a bit of delay here.
Yeah.
So it's been it's been good holidays.
Yeah.
And it's been a time to think about the year and reflect, and we decided to do that together about our season 5, our 5th season of this podcast.
Yeah. Again, still hard to imagine that it's been 5 seasons that we've been doing this, but just want to say I'm still enjoying it, having a great time doing this, and thanks for taking the time to continue sharing.
Likewise, it's been great for me, and this year was a tough one. I lost my wife in May.
Yes, of course.
And you took over very kindly and did some episodes there, and then worked me back in through the only thing I wanted to talk about, which was grief.
Yeah.
And I appreciated the conversations we had there and the way that I was able to come here to the podcast and share those things. And then especially to the listeners, because we got a lot of listener reach outs after that too. That was very supportive and very helpful.
Yeah. Well, we appreciate you sharing your life with us of that thing, and we all send you the very best in the season and time here of thoughtfulness and graciousness and thankfulness for the things that we all still have here. So,
that's right. Yeah. Thank you, Whitney.
Yeah. Well, with that in mind, what we kind of do, usually this is our retrospective time. So we've kind of got this format where we take some of our top 5 most thought-provoking episodes each, and we'll kind of run through them. So what's on your list today for?
Yeah, I got a list, and I want to say I love retrospectives for other podcasts because it gives me an overview of where I could go back and really dig in.
Yeah.
So we'll hit the high points today, but we'll try to remember to mention episode numbers or something so that you as a listener can go back and listen to the whole thing if you want. I think, I'm doing a countdown or count up maybe to my most favorite, which I'll mention last. But in my top 5, I really enjoyed our last conversation. It was 134 about how bodywork changed our lives, our personal lives. It was great to hear your story and reflect back on that. We mentioned that we started this whole project with interviewing each other about our background. So now here into the 5th season, at the end of the 4th season, we got to do the same thing with each other and look at how our lives had changed as a result of doing this work. And we got some nice mail back for that one as well. Yeah.
One of the things that I found interesting about that particular episode, and also that question that we asked each other about how it changed us, is that especially I saw this from the many years of teaching in massage school, of watching people come in and who they were when they started this process and who they were when they finished it. And right. I got to the place of feeling like I could say to somebody, when they said they were contemplating massage school, the one thing I can promise you is it's going to change you. And I think that is true for the schooling and education process, and then, of course, also for the way in which it changes you throughout your work time.
People are really different practitioners at 5 years, 10 years, 40 years. I'm coming up on my 40th, actually, you know what? It's been 40 years. It snuck right by me. 40
Wow.
years that I've been learning and practicing this work.
That's amazing. Yeah.
Yeah, so
Yeah.
that happens. We change as a
Yeah.
result of doing the work as well. So it's great to reflect on that together.
You don't see people staying in professions for 40 years very much these days, so
Mm.
kudos to you for being there and continuing to share with all of us for that time period. That's certainly and then that's kind of scary. Like I think I'm in 36 years,
Uh-huh.
something like that now. I like to have to do the
Yeah.
math again, but like when you add those two together, that's that's a scary amount of cumulative time that we've been chewing
Uh-huh.
through this thing here. So
Yes, that's right.
yeah. And still lots left to go, lots of places left to go with it. So
Still things to explore. It
yeah,
evolves with us as we go, and that was a fun part of that conversation.
yeah.
How about you?
So yeah, I don't have these in any particular order here, but I
Great.
just like these were ones that kind of really hid something for me or hit something for me. Back around this time last year, late in the year, we did an interview with Gil Hedley about his nerve tour, and
Yes. 110, episode 110.
yeah, this was particularly timely for me in that particular episode because I had just gone to his presentation on the
Mm.
nerve tour, and it was a really eye-opening process of looking at things through different lenses. And he does such an interesting and different type of job with what he does in the cadaver dissections. And I think I was really trying to take a pulse of the audience in his presentation and notice that it was really impacting people in a lot of different ways. And I think the same thing with our discussions with him. I don't even know, is it still going on or is he finished? Do you know, has he
He's
finished
now,
that
I
tour?
think, just talked to him recently. I think he's doing the online version now after settling, finally being done touring all around the
Yeah.
country and some of the world to do this new tour thing.
Yeah.
But his that episode was actually on my list too, because I just really enjoy Gil. And you're right, he does an amazingly different perspective of anatomy and the body. It's very much grounded in a tradition. He was actually a student of mine at the Rolf Institute for his first body work entry.
Mhm.
So it's very compatible with that point of view of the body. But he's probably one of the foremost spokespeople now for the evolving state of that viewpoint, which includes both the mysterious and the wonderful, as well as the technical and the arcane and the detailed. He
Yeah.
does such a great job of weaving those two together in an enjoyable way
Yeah.
and a delightful person as well.
And story.
Story,
We
right?
learned so much through story, and the presentation of what he did was woven so well with story. I mean, as an educator, I really watch these things very closely with
Uh,
people, and he did a phenomenal job of just really captivating everyone's interest and engagement with what he was talking about, with the what could be a very dry, detailed kind
right,
of,
right.
anatomical topic about, all these things with the nerves, and especially getting into a lot of the stuff with the nerves that we don't think about that much, the internal cranial nerves and the things that we don't touch or think about and manipulate a whole lot. I
That's right.
really made that whole thing very fascinating. So, always great to have some time to be in his presence and hear the things that he's exploring and looking into.
Look through his eyes. That's
Yeah,
right.
absolutely. What's next?
My next one, well, actually, let me take a second and just mention probably my our guest list was one of my highlights, and I
Yeah,
couldn't get them all into my final five,
yeah,
but we had conversations with Lorimer Moseley, Tom Myers, Sharon Wheeler, Jill Cook, Antonio Stecco, Greg Lehman, some really influential thinkers across the spectrum of perspectives
yeah.
in our field, and that was just in the last year, and I
Hmm.
enjoyed every one of those. So I'm really was pleased at how we were able to have that breadth of conversations with people that are really influencing what we do.
Yeah. And I would also like to just put a plug in for, what we have tried to do here periodically is mix and match some of those things where we bring in
Mhm.
some of those people who are very influential that everyone's heard of and wanted to see and talk to. And then we've also brought in discussions from people that aren't as well known or popular or whatever, but have some very interesting things. Your discussion with Peggy and the Esalen crew that we
Mhm.
had there, and then some other things. I had a
That's right.
very interesting conversation about performing arts massage and some other things that we did here with people that are not necessarily well known, but also really interesting, doing interesting things.
A peek into different worlds, both
Yeah,
the prominent and the everyday ones that are just part of what we're doing in our
yeah,
work as well.
right.
Yeah, very, very, very much enjoyed that.
Yeah.
But in terms of an episode on my list, my number four, I'd say, was our episode 115 with Kathy Ryan and Erica Slocum about the question of can massage spread cancer? And looking at a couple of recent studies that were actually suggesting that mechanisms for our spreading of cancer as a massage therapist, which was alarming, of course,
Yeah.
especially that my wife was dealing with active metastatic cancer right then. But I really enjoyed the chance to think that through with the three of you. And I enjoyed that process too of looking at a couple of studies and parsing out how does that really apply to our day-to-day practice? What does this mean that we should be aware of
Yeah.
and should be thinking about? That
Yeah.
made my list.
Yeah. And we mentioned that this kind of got a little bit of the seed for this from the discussions at the Fascia Congress,
Hmm.
from
That's
that
right.
study that had
Peter
come out
Friedel.
saying, saying there
Hmm.
was some concerns about massage and cancer. And again, this is one of those places where we just still don't have a whole lot of information, but I think everybody needs some degree of reassurance and certainty about what they can and should not necessarily be doing. And I thought
Yeah.
that was treated well in that episode.
Reassurance and certainty. And I should probably do a spoiler so that you don't have to go listen to the whole episode to know what the takeaway was. It's there are concerns, and you
Mhm.
should be aware of those. And at the same time, there's so much good we do that we shouldn't be afraid and be holding back in ways too.
Yeah,
So I mean, it's like, do we massage tumors? No. If you know it's a tumor, don't go massage it.
right.
Should we touch people? Yes.
Hmm.
We should be doing this work.
Yeah.
With Like, go if you want to dig into the details
Mhm.
and the very practical suggestions that those two made, go listen to 115.
Yeah.
Check that out. What's next,
Great.
Whit?
Yeah. So you kind of mentioned this in our guest list here. This was one I think that was probably pretty influential for both of us and for many of our listeners. The interview that we did with Lorimer Moseley on
Hmm.
explaining pain. And there's just so much rich stuff to take out of that discussion of looking at it. And I was reflecting on this a bit too, how this has changed so many people's perceptions in the world of manual therapy in particular about what we're doing and why we're doing the things that we're doing, is understanding some more about how pain really works, and also the processes of what we do in trying to describe or explain the nature of this to the clients that we're working with.
Hmm.
And he definitely had a lot of interesting insights. It was certainly fascinating to talk to him in reflection of the time frame that has spanned between that first TED Talk video that he did that went so viral about the nature of pain and how his thinking has changed about pain processes and what we're doing and the things that are beneficial for us. So,
That's right. That was episode 111.
yeah.
And he really has been the superstar of pain
Mhm.
in a way. And like you said, articulated a point of view that radically changed the way people are thinking about it. You'll recognize the seeds or the roots of that perspective. I mean, the vocabulary that's developed has been the biopsychosocial perspective, but so much of it was there already. But he gave many of us a clear vocabulary and model to describe the ways that we have of working with pain. And it was great to hang out with him and have the conversation and ask the specific questions and
Yeah.
hear where he's at now as well
And,
too.
and I think one of the things that was really impactful for me coming out of this was recognizing again that there are so many different factors that influence whether or not somebody has pain, and consequently, there are many ways to reduce it and
That's
to
right.
tackle it. And it's not like there's a pain technique. There's a thing that works on every kind of pain in the same way. There's just so many different avenues and pathways into that we can take that might be beneficial in helping people out of it.
He's a compelling and thoughtful spokesperson for that point of view as
Yeah,
well.
yeah, for sure. So what's next on your list?
Next on my list, my number three, if I went and ranked them, was our episode 119 with Rochelle, Clausen, and Nicole Trombley, where we
Yes.
talked about the retinacula.
Uh-huh.
That was the main thing we talked about. We talked about a lot of stuff. As the ankle's most sensitive fascia. That was the title of that episode. And I like it because they are up and coming teachers that are offering something really quite refined in a great way. I believe they're off their school is called Anatomy Scapes, but the
Yeah.
link, if you go to 119, you'll find all about them. I enjoy their perspective a lot. I enjoy what they've taken, again, that same tradition that Gil Hedley's in, that I was originally trained in, that fascial point of view. They've taken the science and their research and applied it very specifically so that everything they're saying is quite backed by the research and actual clinical, research observations, and they're
Yeah.
applying it to clinical context as well.
Yeah. That particular episode was interesting for me because one of the big important shifts that came out of that for me was this idea of looking at the retinacula
Uh-huh.
more so as a proprioceptive organ and less so as a mechanical tether and pulley system, which is the way it's often
That's right.
described in many of our anatomical approaches. Is that yes, it's holding the tendons close to the joint so they can have their proper angle of pull, and so
Uh-huh.
that's its main function there. But these tissues have rich proprioceptive innervation and consequently are highly refined sensory receptors in there, which I found fascinating as
What if
well.
some of the fascia's purpose is to help us feel what's happening?
Yeah.
And that's the point of view they're bringing out about the retinacula, which has the highest concentration of mechanoreceptors of any fascial tissue, it turns out.
Yeah.
And it's interesting to me too that their point of view that fascia has a role in proprioception is really congruent with the biopsychosocial perspective that says we're influencing people's experience and their brain as much as their mechanics and their or maybe more even than their mechanics and their structure.
Yeah.
So even though they're coming from the other side of that debate that sometimes gets juxtaposed as a polarity between structuralism, fascia, and pain science and neurocentricism. There's the people that are unfolding those points of view are converging in various areas to say, well, actually, this is a helpful way to think about it, no matter what's your starting point.
Yeah. Very good stuff in there.
And then what do you got?
Next on my list was our conversation with Greg Lehman, Movement
Yes.
Optimism in episode 114.
Mm.
I can't think of a time where I have listened to Greg and not come away with something that either really fascinated me or really challenged my existing, belief systems or processes or things that I had been focusing on and teaching for a long time. I remember the first time I met Greg in person a number of years ago back at the San Diego Pain Summit, and was just really fascinated with, first of all, his just unparalleled grasp of the literature, being able to
Yes.
rattle off and recite these studies off the top of his head that he's immersed in. Somebody who is that immersed in that process really has developed a really good resounding worldview, I think, of the nature of processes associated with rehabilitative manual therapy, and his background, multidimensional background in chiropractic and physiotherapy and biomechanics. Something that I,
Yes.
of course, find very fascinating and highly inspirational. And I
Well,
liked his concept of the movement optimism
yes.
that he was proposing for us.
Movement optimism is that we can be hopeful in ways, and movement is the key
Mm-hmm.
to that. And what's great about his superpower, as he called it, to be able to give the references, citations, sample size, variables involved for every for every idea that he has. What's the great counterpoint to that is his simplicity of his model, and he's actually asking us to think simpler and to
Yeah.
think in scale too, like the magnitude of effects.
Mm-hmm.
Because he gets really detailed about some of the mechanisms, but in the end, I think a lot of it comes down in his point of view to how significant is this in terms of its magnitude or its effectiveness,
Yeah.
which is a great variable to put in there. Great way to think about things is like we can spend a lot of time arguing about finer points, but what really is significant enough to make a difference in clinical practice?
Yeah.
He's got some great points around there. I always enjoy him too.
And like you said, I think, distilling that down into simplicity and it's like, saying, don't get so wrapped up in all of these different specific techniques, approaches, and things like that. Basically, a lot of it is just going to boil down to calm stuff down and then build it back up. Was his sort of
This
mantra
mantra.
about that
Mhm.
whole thing. And I think the more we can think along those lines and recognize that there's a lot of different paths in the way that we get there. We have these hundreds and hundreds of different modalities and methods and things like that, but we're all basically, that's pretty much what we're doing most of the time if we're on track with trying to get people back into a pain-free state as much as possible.
And then his writings, his early writings didn't really reflect this, but I see as the years go by, him mellowing in terms of his uh, ardor for that point of view, and
Yeah.
making a lot more room for other perspectives. And I think that's inevitable too, as all of us mature and start to test our ideas out in the real world. We go, okay, so it's not just one way, perhaps. Even
Yeah.
though I feel strongly about this perspective, let me find a way to talk about it in a way that makes room for others as well. And I see him doing that too, which is great to see.
Yeah. All right. What have you got
My turn.
next on your list?
Yeah, I it was a tough call, but I think my number two there was the conversation I had with Sharon Wheeler and Wojtek Kakowski
Hmm.
about her legacy. Her work is what she calls ScarWork, but then the legacy of that work and her personal story. She really represents to me, Sharon Wheeler
Hmm.
represents, and she describes herself this way as Ida Rolf's experiment in non-academic learning and practice of this work.
Hmm.
And she had no anatomy background. She had very little uh, science background, I think, but just was thrown in as a practitioner. And the the experiment was, can she learn this work by practicing? And her classes, which are still very popular, are poetic, are compelling. People love them a lot. They give people metaphors and ways to work with scars or bones or things like that that aren't limited, you could say, by the research or by the scientific point of view. And I give her some credit for that. Although it's not, I put a lot of stock in research and empirical
Hmm.
understanding, testing things out. I also honor her in their place in the lineage we have of saying there's a place for just feeling things and imagining things and working from there and
Yeah.
getting amazing results from that as well.
Yeah. And I think this really gets us back to paying attention to not being as attached to some of those model descriptions of what is exactly happening there. But, can you find a way that works to do what you're trying to do? And
Yes.
we'll continue to work towards finding an explanation for why this is happening. But if you've got something that is working and is effectively achieving your goals with people, let's keep exploring that and let's keep pushing the envelope with it, which I think she has done a great deal over the course of her many years and influenced lots of people in the process.
And like you made the point, Whitney, that it was as much talking about her legacy and her evolution of her work at the Esalen Institute, where I was a few years later. So that had some personal meaning for me too, to hear her what was happening there just a few years before I was there and that she was involved in.
Yeah. Yeah.
133, check that out if you want to hear more.
Yeah.
What do you got? What's next on your list?
I really enjoyed the conversation you and I had about low back pain
Ah,
because this is so prevalent for everybody. And we just kind of did let's revisit this topic and see what's new and different and kind of like what's out there. And
this was
there's,
episode 127, and it was
yeah,
just you and I talking about our updates, our own personal updates on our understanding of back pain.
yeah. And,
Yeah.
we are at this point in the end of 2024. We're a quarter of the way through the 21st century, and we still don't know what causes a lot of people's back
Uh-huh.
pain.
Uh-huh.
So I think we're still in that place of, inquiry and looking into things and trying to find answers for a lot of things. But there's a lot of help out there that we can offer people through what we do in the manual therapy world. And I'm certainly recognizing my rapidly imbalanced number of days ahead of me compared to those that are behind me at this point of my career. I just
Hmm.
had a birthday last week actually.
Happy
Thank
birthday.
you, turned 63. But I really, was hoping to see us make some very significant strides toward a greater acceptance of the role of manual therapy in addressing low back pain things. And I think we still have a long way to go there because there's I still went in reading the literature and listening to a lot of the discussions in at least traditional medical environments that much of what we do in manual therapy is still sort of poo-pooed and brushed aside as not necessarily that helpful for people. But I don't think that's the experience that a lot of practitioners have in terms of
Right.
what they do in the treatment room. So,
And
uh,
yeah, and the client experience too.
yeah,
I mean, back pain is one of those things where sometimes we don't help as much as we'd like to, but often we do.
yeah,
I mean, I slowed my own practice down quite a bit and put it on complete hold in the last year for just in my caretaking role
mm,
and starting to pick that back up again. But the few clients I saw during that time were back pain clients. Those are the ones that got people motivated enough to come to me and just convince me, like, you got to see if you can help me with this. This is
yeah,
really hard.
mm,
So it is so common, it's so important, and I think we actually do help. So
yeah,
as part of the mystery is what are we doing? How do we explain what we do that helps?
yeah,
But it was a great conversation about that and
yeah,
about what we actually do. There's some
yeah.
very practical parts of that conversation too that I appreciated.
And what I think is so fascinating about that is just, how we can have so many very different approaches to this that can all work in various different ways. I know I take a lot more of kind of mechanical, anatomical, orthopedic perspective when I
Mhm.
first start looking at things. That may
Mhm.
change as I get through into the process with somebody and find out what's happening there. But I know that's my bias. That's where I have lived the majority of my career and kind of mindset. And then I'll see people taking a very different kind of approach and perspective in what they're doing, and also getting great results with people doing different things. So,
That's right.
I think there's all kinds of benefits in learning the different things that we learn, and being able to see some of these different perspectives and integrate. Look at how they'll work together to piece together or something that makes your unique uh, perspective and practice with your clients.
And there's a place for understanding different explanations for what we do.
Mm.
That helps me maybe take my own a little less like gospel or opens me up to other possibilities. I really enjoy that process.
Yeah.
And at the other side, there's a role for really fully inhabiting and standing for what I feel and know and see, and that seems to work
Yeah.
too. I remember, if I'm not Greg Lehman, so I'm not going to be able to cite the author and the year of the study, but I remember a study that compared different practitioners' confidence in their work addressing low back pain.
Hmm.
And they intentionally selected practitioners across a range of disciplines that had actually completely reversed laws of biomechanics they were working from. Some schools say that the lumbar vertebrae rotate one way in side bending. Other schools say they actually rotate the other way. So they're working off of completely complementary laws, biomechanical laws.
Yeah.
And this study rated their feeling of being effective in their work.
Hmm.
And then they had the practitioners do what they were trained in, and they had to do the opposite way to see what that was like. And of course, the biggest variable was what you were trained in was the one that you felt had the best results afterwards.
Yeah. Yeah.
And even when you were asked to turn it around, it's like we can just imagine what that would be like to do the reverse of what you think should be done. Even though there's schools that were getting very good results with those laws, when you do it as a practitioner who just wasn't quite trained that way, the results, you didn't have as much faith in the results there.
And I think
They're-
that, yeah, so much of that comes back to the discussion we had in that early episode, and I don't remember our number now, about the confidence that
yes,
a client brings to you as a practitioner.
right.
That has a significant benefit in the outcomes, in the therapeutic outcomes that we're seeing. And that's, this discussion has come up a lot with all these debates about, is this, with the discussions about like how important is technique, how important,
Uh-huh.
if we're saying that all these things aren't really necessarily based on a particular technique working, is it really that important at all? And then, I always kind of come back to the yes and no. Is that, it may not be as important as we thought because of the physiology of what is necessarily happening with that particular way we move our hands in touching our client's body.
Uh-huh.
But the way in which you use your informed hand and your informed touch exudes a sense of confidence in what you're doing that has incredible therapeutic power to that. And so that technique does matter, I think, in that instance, because the way in which you touch that person and then engage with them therapeutically, based on your confidence in what you're doing, has incredible power for the beneficial effects we're trying to get.
That's right.
Yeah.
That's right. So we're up to my top
Yeah.
choice. My
Yes.
top choice, I cheated. I got 3 for 1 in my top choice. I did
Mhm.
the 3 conversations we had in the grief series, the 3 episodes where grief was the focus. And of course, that had a lot of personal meaning for me, especially your invitation to come talk to you about my process.
Mhm.
This is only a few months after my wife had passed. That was episode 125,
Yeah.
where you basically just walked me through what that was like
Mhm.
to lose my wife, both in the personal sense, but also in the professional sense.
Yeah.
How that might apply to working with clients or how that was taking shape in my own practice, etc. I
Yeah.
was really moved by that and appreciate your welcome and your gentle facilitation of that.
Mhm. That was a fascinating series of things and again, I both applaud you and thank you for opening your life up to the rest of us to see this because we got a lot of feedback from people about resonating with what you said from various different things that had happened to them throughout their lives, dealing with grief either personally or with clients in these kind of situations. And it's a topic that I think doesn't get probably talked about a lot
Mhm.
as much as it certainly should for the way in which it impacts people a great deal. And so you gave us some really good and valuable insights there with those series of episodes that you went through there.
Well, the hidden part of that is we all deal with grief at some point in our life, and
Mhm.
that so many of our clients are dealing with that in the background, whether they're telling you about it or realizing it themselves or not. That's often there for people. Even just in the getting older process, there's loss. We lose things that were
Yeah.
available to us before. The other 2 episodes in that series, episode 132, where Rana Moore came in and talked, she's got a really nice set of examples about how in a massage therapy practice that those ideas around grief and grieving were coming in and influencing what she did. She was a spectacular presenter in her own right, came in and talked to us about that. And then especially episode 130, The Body of Grief that's what we called it, but it was with J.S. Park,
Hmm.
whose book As Long as You Need was a big support for me. And I've loaned mine out and bought people copies since then. But his manner or his way of showing up in that interview itself modeled a lot about that process. And it's probably the one episode I've heard the most about from listeners this year.
Uh-huh.
This
Great.
episode 130 with J.S. Park.
Yeah. Wonderful. Well, again, thank you so much for sharing that process. It was valuable, helpful, just educational and emotionally engaging for all of us, I think. So,
Thanks for bringing that.
and we thank you all, listeners, for giving us input about that as well. So,
What's left on your list?
the last one on my list was the conversation I had with Jill Cook, which I
Uh,
had anticipated quite a bit, and it did not. Did not disappoint at all. Mainly because I had heard her say some things on a different podcast. Or like, oh no, this is like completely contrary to what I've been saying, teaching,
yes,
and doing for a long time. I got to talk to Jill and find out like what
yes.
the story is here. So
This was the topic. This is episode 128, and your
yeah,
topic was tendon pain,
yeah.
which is her area of research and clinical specialty.
Hmm.
And I was really pleased that you were talking with her. I was sorry I couldn't make it because she's been a big influence on my thinking and my understanding about tendons, tendinopathy, and inflammation.
Yeah,
And I really enjoyed listening to your conversation with her to hear right from her how she viewed those things because she's often cited in the various debates
yeah.
tendinopathy, tendinitis, and on both sides of that
Hmm.
debate, saying, yes, there is inflammatory contribution to tendon pain. No, there's not. It's degenerative, which each of those have implications in how we would work as manual therapists.
Yeah,
So to hear her, uh, in spite of some refining over the years she's done of her point of view, just re-articulating that and what that means in terms of load being the main thing, the main variable that helps people. And she was not a fan, if I remember right, of direct manipulation. Leave it alone, which is certainly an important point of view and something to keep in mind. It's not
yeah,
like if it's been irritated, don't go like scrub on it and make it
yeah.
worse.
Right.
Yeah.
Which is what a lot of us have been doing for a long time.
Uh,
Now,
uh,
what I, still had to wonder about that is like, it does seem like there's been a lot of reports of beneficial results from doing that. So how
yes.
did we get those results? And
Right.
you know, maybe they came from the other things that we were doing in addition to that. You know, it's
Maybe.
hard to know exactly what that was, but
I mean, my own point of view, because I think a lot about inflammation and teach about it, is that we're restarting a cycle. And actually, what she said wasn't in contradiction to that at all. She
mhm.
talked about the effects maybe having stimulating effect on different cells that are in trouble in that process and things like that. And I think that that's a explanation that fits a lot about why direct work can help things that are tendinous and painful and
Yeah,
chronic. But it was from her point of view as a researcher and a physical therapist, it was great to hear her articulating that very clear point of view about here's what we know, here's what
yeah.
helps, here's what doesn't.
And I think one of the most fascinating and influential things that I got out of that discussion, because I had wanted to ask her this question for so long,
Yeah.
and it's interesting because I heard Greg Lehman on his podcast have a discussion with somebody about tendinopathy just recently as well, that despite all of this research that we've been doing, quite honestly, we still don't know why tendons hurt from
Yes.
tendon pathology. You know, there
Right.
seems to be multiple factors involved. You know, years and years ago, we, ascribed this to torn tendon fibers and the inflammatory process associated with them. And
Yes.
now
And
that just
then
has been sort of like, well, no, not really. That's
and
not
then
what's happening. Yeah.
Dr. Cook's point of view
Yeah.
was no, there's not so much inflammation, or it's not the main driver at least, so that doesn't explain the pain.
Yeah.
But we don't know what does.
Yeah,
Yeah.
and neither does the degenerative process because there's lots of degenerative tendons that don't hurt.
Don't hurt. Yeah.
So, and it's kind of back to, I think, a lot of what we were seeing in Greg Lehman's cup concepts. Like everybody brings a cup full of all these different factors to their world, and
Mm.
any of them in combination may be sufficient to set off the body's alarm system of producing pain.
Stress,
Yeah,
dietary influences, exercise influences, sleep influences,
yeah,
all these different things could be in your cup and be
yeah.
part of your pain experience or not.
Yeah. I mean, I've seen this for myself personally and know of, I've seen this a lot of times in clients and other people of reporting, increases in things like tendon pain when they got the flu,
Right.
so
Yes. Or
that's,
after the holidays, after eating a whole lot of sugar. I
yeah,
just had
uh-huh,
someone the other day says, "Oh yeah, it's the holidays. I ate too much sugar. My joints all hurt,"
yeah,
which is like
uh-huh,
an inflammatory fuel, perhaps, if you
right.
think about it
So
that way.
all kinds of factors may potentially get jumped into the mix there, but
Mm.
all of these things, I think, really valuable and really helpful things for us to chew on and think about in exploring how we approach our practices and the things that we do in the treatment room with people.
It's been a good season. Thank you
Yeah,
for this retrospective and looking back on it.
absolutely. And I am looking forward to season 6. Don't know all the things that we have in store yet, but we
We
have
got a
some
few.
interesting ideas of things that we want to get into and chew on. And of course, this shout out to everyone who is still listening after this number of minutes on the podcast. Let us know what you want to hear about, because we really would like to make sure we're doing things that would be helpful and beneficial for your learning process as well. So don't hesitate to let us know what you want to hear about.
I love just going for what I'm interested in and seeing if people listen.
Uh-huh.
And some do. But yeah, I still would love to hear, was that good? Is there
Yeah.
something else you'd like to hear better? That's super helpful. So let us know that as well.
Yeah. Yeah. We each have our things that we think are absolutely fascinating, and other people are like, yeah, like
Right.
whatever. So, yeah.
Right, right.
Yeah. So, all right. Well, I think that will wrap up our season 5 retrospective. Anything else that you want to add into that before we close out today?
No, like I said, it was a wonderful year, and I'm excited about the coming season as well, and really grateful to our sponsors
Yeah.
for making this all possible, and to you, the listeners.
All right, that sounds good. And speaking of our sponsors, we would like to mention the Thinking Practitioner is supported by ABMP, the Associated Bodywork and Massage Professionals. ABMP membership gives professional practitioners like you a package including individual liability insurance, free continuing education, quick reference apps, online scheduling, and payments with Pocket Suite, and much more.
ABMP CE courses, podcast, and Massage and Bodywork magazine always feature expert voices and new perspectives in the profession, including articles from Whitney Lowe and myself. Thinking Practitioner listeners can save on joining ABMP at abmp.com/thinking. And if you have a chance to tell the ABMP that you heard about it here, that actually really does help the show as well. It lets them know that their support makes a difference too.
That's great. Yes. And thanks to all of our listeners for hanging out with us and to our sponsors. As we said, you can stop by our sites for the video, show notes, transcripts, and any extras. You can find that over on my site at academyofclinicalmassage.com. Til, where can they find that on your site?
Advanced-trainings.com, which is undergoing a revision. Excited about our new website that's launching soon. Yep.
Look forward to seeing that. Yeah.
Like we say every episode, we mean it. We want to hear from you with your ideas or input about the show. Send us an email, send us a voice memo, send us a social message. Email us if you want, info@thethinkingpractitioner.com, or find us on social media under our names. My name is Til Luchau. Whitney, what is your name?
Today, my name is Whitney Lowe. You can find me over there on social as well. And also be sure to check out the list of supplies and wealth of resources we have over on our YouTube channel under my name as well. And we'd also like to really appreciate if you would rate us on Apple Podcasts, as it helps other people find the show. And you can hear us wherever you listen on your favorite podcast app. Please share the word, tell a friend, and we will look forward to seeing you in the next episode.
Thank you, Whitney.
All right. Thank you, sir. Have a good year, and we'll talk to you soon.